Constipation is a gastrointestinal disorder that results in infrequent and painful passing of stool. Constipation is a result of hardened, dry stool, which happens when your colon takes too much of the water that needs to be in your stool. Now, let's get into some of the causes of constipation. Some genetic causes can be part of a diagnosis of Hirschsprung disease. This disease is genetic, though more common in males. It occurs due to a chromosomal disorder. Constipation can also be associated with a genetic mutation. Some environmental causes can include dehydration, not eating enough fiber, lack of exercise, being an older adult, being a woman, especially during and after pregnancy, not drinking enough fluids, ignoring the urge to pass stools, and in babies when switching from breast milk or formula to solid foods. Diagnosis of the disorder. Your doctor will ask questions about your medical history, your symptoms, and your daily routine. There may be a physical exam, or your doctor may perform some lab tests, including blood tests, stool tests, or a urine test. There could also be a rectum examination and/or an x-ray. Some signs and symptoms to look out for: passing fewer than 3 stools a week, having lumpy or hard stools, straining to have bowel movements, feeling as though there's a blockage in your rectum that prevents bowel movements, or feeling as though you can't completely empty the stool from your rectum. Treatments of the disorder include: increase your fiber intake, exercise most days of the week, laxatives such as stool softeners, fiber supplements, osmotics, lubricants, or enemas and suppositories. You could also have surgery. You could train your pelvic muscles. There could be medication that draw water into your intestines. As for the prognosis, it's generally excellent. The survival rate of people with constipation is 100%. Constipation may increase the likelihood of hemorrhoids and associated symptoms such as anal fissures, which is a painful wound in the anus, or enterocele or rectocele, which is vaginal descent or collapse, or perenation of the bowel or rectum into the vagina. Current research being done to develop new therapies as of 2021 to 2022 include an innovative treatment to chronic constipation, vibrating capsules that stimulate the bowel's non-pharmacological performed well in a late-stage trial that could lead to FDA approval by the end of 2022, according to a Houston Methodist researcher. Second, the purpose of this study was to investigate the efficiency and safety of the traditional Chinese medicine Besunian detox tea, or BDT, for FC, and to compare the effect of BDT on constipation patients with non-dryness heat syndrome. The third study's purpose is to assess the long-term outcomes and patient satisfaction for patients who had partial removal of the large intestine for chronic constipation that was caused by the slow transport of waste. Thank you, and I hope that you learned something from this video.